So let's spend some time talking about the circulation of the head and neck. Let's talk about up here now. Okay? Here's your aortic arch. The first branch is the brachiocephalic artery. The brachiocephalic artery branches into two. There's one here that they cut off and they didn't label. That's the subclavian. That's the right subclavian that goes out into the arm. And then you also have the common carotid, the right common carotid that goes up and splits into two. One is the external carotid, gives blood supply to the face and muscles, that area there. And then you have the internal carotid that's going to go inside the brain and give blood supply to the brain. The first branch off the subclavian goes through the vertebral column, the cervical vertebrae, those little transverse foramen that are on the cervical vertebrae. The vertebral arteries are going to go through those foramen. They go through there, and that is also going to give blood supply to the brain. So again, two major arteries that give blood supply to the brain. Well, four, right? On the other side too. You have the vertebral arteries and the internal carotid arteries. Okay? So again, start with what you already know. You have this aortic arch and three branches. 1, 2, 3 off of it. Brachiocephalic gives blood supply to the external carotid and internal carotid. Okay? External carotid has that vertebral artery that's also going to go up to the brain. The internal carotid goes into the brain also. The external carotid has a few branches. I'm not going to go through them, but they're on your list. They're pretty straightforward where they go. All right? Facial artery, occipital artery. But keep in mind, when you see occipital artery, that's not going to the occipital lobe of the brain. It's going to the occipital portion of the back of your head, supplying the scalp back there, the hair, the skin back there. All right? So occipital artery comes off the external carotid artery. It gives blood supply outside the skull, but in the back portion. So you'll learn about those. Maxillary artery, you'll see where those are. This gets a little bit of a monster. I want to spend time on that. So again, the internal carotid goes into the brain. The vertebral artery also goes into the brain. And it makes this circle here in the brain. This circle has a special name. It's called the circle of Willis. Okay? Now, circle of Willis has a lot of branches coming off of it. The way I see it is it looks like a spider. So I think that there's this ferocious spider living in your brain, and you have these branches coming off, and I'll show you what it looks like. Now, what's really neat about this spider is that it's just coincidental that the spider's name is Willis. It's supposed to be a joke. All right. Okay. His name is Willis. So let me tell you what he has. This is a spider that has a nose, angry eyebrows, 2 suckers for mouths, 2 eyes that look outward. I'll explain what that is. A crew cut, a fuzzy beard. So far he looks like me. Okay? 8 legs, hairy armpits, a belly that you could visualize 2 different ways, and I'll show you what I mean. It could be very rotundo, or it could be very thin. You can see 2 different ways. He has 2 feelers on his rear legs, and he has a little kadinka. Okay? So let me explain to you what he has. Okay? This is what he looks like. That is basically the blood supply in the brain. He looks like a little guy over there, right? Little spider. So let me show you what we have here. All right? There is this circle I'm talking about. Just to orient you, the pituitary gland is coming out in the center there. That's the nose. The mammillary bodies is the suckers for mouths. Remember the mammillary bodies? Not these. What do the mammillary bodies do? What do they have to do with in the brain? See, it really works. Memory. Okay, all right. So that's where that is over here, all right? And then these angry eyebrows, that's where the optic nerves cross over. Remember the optic chiasm? So you have an idea where the circle is, if you remember the brain from AMP1. Now, this is where the internal carotids are coming in, or coming into the brain. So those are the eyes. But look at the way it is. You're looking at the end of it. That's where the internal carotid ends. And then it splits into three. 1, 2, 3. So what it looks like is this. I kind of made this little thing last semester. We're looking at it like this. So here's the internal carotid coming up, but it ends right there. And then it splits into three things. 1, 2, 3. So you're looking down at it. Does that make sense? That's why it looks like a circle there. That's where the internal carotid ends, but it splits into three on both sides. There's going to be an anterior cerebral, a middle cerebral coming off, and then this is the posterior communicating. So let me just, and I'll do some pictures up here. The anterior cerebral goes up, and there's a connection between the two. That's called the anterior communicating arteries. They connect the two anterior cerebral arteries. Okay? You also have the posterior communicating. Now this isn't really drawn to scale. This is a very schematic drawing because it looks like a spider. But there's actually two posterior communicatings. There's one on this side and there's one on this side. I'm going to show you what it really looks like, but I'm starting off at a very simple picture first. So that's like the beard that we have here. Okay? Then this is where your vertebral arteries are coming in. They're coming in from the back here, the back legs. Two vertebral arteries. They converge and become one basilar artery. The basilar artery sits on top of the pons, which is part of the brainstem. So that's why I'm saying the body of the spider looks like, if you just look at the basilar artery, it's very thin. But if you want to picture the pons with it, then it's rotundo. Okay? This is what I mean by his eyes are looking outwards. So let me show you what's going on here. This is the brain, right? Looks like a boxing glove. Okay? This is the cerebrum, right? His nose is over here, his mouth, and so forth. Okay? Back here is the cerebellum that controls balance and coordination. And then you also have the brain stem. And once it goes through the foramen magnum of the skull, then the brain stem tapers off and becomes the spinal cord. Okay? So those are the three major parts of the brain. The cerebrum, the thinking part, the cerebellum, which controls coordination, amongst other things, and the brain stem, which is vital, which controls heart rate, breathing, blood pressure. Now, the cerebrum. How many lobes are there in the cerebrum? Lobes. All right, there's 5 lobes, okay, but I'm only going to do 4, okay? There's something called the frontal lobe. Oh, it's hitting now, all right. The parietal lobe, the occipital lobe, and the temporal lobe. There's something called the insula lobe, but you have to like take the temporal lobe and frontal lobe and reflect it back. It's underneath that, but we're not going to talk about that one, okay? So frontal lobe, all right, does the thinking part, all right, that also controls skeletal movement, skeletal body movement, voluntary movement. You're going to need to know what they do. I'm telling you, because I'll be pointing to this and blood supply doesn't go over here. What won't you be able to do? You got to think of A&P as not a 15-week course, it's a 30-week course. I have to assume you guys remembered it. Does that make sense? Because I'm going to ask questions about it. The parietal lobe takes care of sensory. Everything that's coming up is going to go into the parietal lobe. Occipital lobe takes care of vision. All right, interprets vision. Temporal lobe takes care of, I'm just giving you some examples, but temporal lobe takes care of like auditory stuff, okay? So, occipital lobe. So we have a stroke to the occipital lobe. If there's, and we're going to get into it, let's say the posterior cerebral area artery doesn't go to the occipital lobe, you're going to have a stroke here, less oxygen. So then how is the person going to present? He's not going to be able to see properly. He's not blind, he's just going to say, you know, if I point to, if I give him this and say, what is this? He's going to say, that's a dog. I mean, I can see the tail there and the ears. He sees, he's just interpreting things differently. All right, and that's important. No matter if you're going to be a nurse, a doctor, you're an occupational therapist, you're going to go see the patient and say, yeah, Mr. Johnson, pick up your shirt, and he picks up his bow tie because he sees it differently. And you're going to have issues with that when you're, when you're dealing with these people, okay? So frontal lobe, parietal lobe, occipital lobe, temporal lobe. Where is Willis living? He lives over here on top of the ponds, okay? And he has 3 blood vessels going to the cerebrum. 1, 2, 3. This one is called the anterior cerebral artery. Now be careful with your abbreviations. Cerebral. We're going to talk about cerebellar. You put CER, you don't know if it's cerebellar or cerebral. You can put CBL, but again, you don't know which one it is. So be careful when you write down this stuff. Does that make sense? Okay? This is going to be our middle cerebral artery. Okay? And this last one over here is going to be our posterior cerebral artery. So the anterior cerebral gives blood supply to the frontal lobe. The posterior cerebral gives blood supply to the occipital lobe. The middle cerebral gives blood supply to the temporal and the parietal lobes. So if I say you have a blood clot to the posterior cerebral artery, what won't that person be able to do? You see what I'm saying? These are questions that can appear on your practical exam. You have to bridge A&P1 and A&P2 together. I have to assume you've gone through the brain. All right? I won't have time in class to go over the brain. It's not going to happen. All right? I got so much new stuff to do with you guys. You're going to have to bridge it yourself. Okay? Now, the cerebellum. And here's where these arteries are. There's our anterior cerebral, as I mentioned here. Here's the middle cerebral, and then we have here the posterior cerebral. Okay? I underlined them in red. Now, we also have 3 blood supplies going to the cerebellum. 1, 2, 3. Okay? This one's a little bit different, and God created us this way. I can't complain. Well, to Him, I'll do it. Here's the cerebellum. Okay? So you're looking at the left lateral side, just the way I have it here. The way this is split up is like this. we have a superior portion of the cerebellum and an inferior portion of cerebellum. Does that make sense? So we have a superior portion of the cerebellum, and blood supply goes here. It's called the superior cerebellar artery. Now this is where he got a little funky. He decided to, and I don't know why, but he decided to make the inferior cerebellum split into two. You have this portion here, all right? That's called, and just listen to it, the anterior inferior cerebellar artery. Does that make sense? Right? That's chapter 1 stuff. Anterior inferior cerebellar. So, what do you think this one is? Posterior inferior cerebellar artery. All right? Make sense? Now, just so you can see this, if I take this cerebellum and I'm going to turn it 90 degrees, then that you will see just the superior portion of it. You're just going to see the top of it. Does that make sense? How I'm drawing it? If I turn it another 90 degrees, it'll be upside down. So here's the cerebellar, or the superior portion. Here's the anterior inferior cerebellar. And then this will be the posterior inferior cerebellar. If I turn it one more time 90 degrees, what colors should I see? Right. You're going to look at the inferior portion. And it'll be the posterior inferior on this side and the anterior inferior on that side. Does that make sense? How this is all split up. So we have 3 going to the cerebrum and 3 going to the cerebellum. The superior cerebellar, the anterior inferior cerebellar, and the posterior inferior cerebellar. Where are they here? The superior cerebellar comes off of here. The anterior inferior cerebellar is here. And the posterior inferior cerebellar comes off the back leg. All right, so let me put this all together now for you. Here's the circle of Willis. The internal carotid is going to give blood supply there. You're going to have 3 branches off the internal carotid arteries. The anterior cerebral, the middle cerebral, and the posterior communicating. There's an anterior communicating that connects the 2 anterior cerebrals. The vertebral arteries come from the back side. They're our back legs of the spider. They're going to converge and become the basilar artery, and you'll see in the next picture, it then changes its name into the posterior cerebral. So it's kind of doing this thing. And you'll see it by the other pictures. The 2 front legs here, the posterior cerebral and the superior cerebellar, have a cranial nerve that comes out between them. That's cranial nerve 3. That's the hairy armpits. So if I label the superior, if I label this bottom one here, and you know it's underneath the cranial nerve 3, then you know that's the superior cerebellar. If I label the one above the cranial nerve 3, then you know that's the posterior cerebral. You did learn about cranial nerves. I'm not going through that again, right? If not, you got to go back and review. Okay? But the cranial nerve 3 is there. Okay? That's the landmark. Do I make the turn before McDonald's or after McDonald's? It's all about directions. Okay? There's another, and over here, this is a few other things. So here's the back legs, these are your vertebrals. So here's what a spider is, the 4 legs. One is going to be the posterior cerebral, the other one will be the superior cerebellar. The first branch coming off the basilar is going to be the anterior inferior cerebellar, and the back leg here is going to be the vertebral. There's feelers, I call them feelers on the spider, but the feelers coming off the back legs, that's the posterior inferior cerebellars. And there's the cadinka. So this is going to be the anterior spinal. It's going to go down the spinal cord and give blood supply to the anterior aspect of the spinal cord. That's called the anterior spinal. The only one that's not labeled on here that you need to know is the pontines. And there are 4 or 5 branches that come off of here on either side and give blood supply to the pons. Pontines, pons. Okay? Questions so far? All right, let's give you, and let me also, I'm going to explain to you that this circle is key. This is why strokes are not the #1 killer in America. It's because we have this circle going here. Circle is vital to keep us alive, and I'll show you why. Okay? So let me give you some other things about this, or just reviewing. Okay? Here's Willis. He sits over here, as I showed you on that picture there. He sits on the pons. Okay? 3 blood supplies go to the cerebrum. Anterior cerebral artery, middle cerebral artery, and we have another one that goes to the posterior cerebral artery. Okay? Internal parotid gives blood supply to the anterior middle cerebral, whereas the vertebral is going to give you the posterior cerebral. This is not really simplified, but it's more of a summary. The cerebrum has 3 branches. The anterior cerebral, the middle cerebral, and the posterior cerebral. Boom, boom, boom. The cerebellum also has 3 branches, but it doesn't have a middle branch. So I consider him a sap. All right? He's got the superior cerebellar, the anterior inferior cerebellar, and the posterior inferior cerebellar. Okay? You see the spider? You see his 2 eyes. There's the circle. Here's what you already know. Here's the heart, and then you have the aortic arch. So now I want you to see the circle Willis and everything in the brain when you connect it to what you already know. Okay? This is also another good picture showing here's the aortic arch and how it actually comes in to the circle Willis and the branches there. This is what the circle Willis really looks like. There's a circle. This is basically the internal parotid coming up, kind of twist. There's 3 branches coming off of it, just like I showed you here. 1, 2, 3. Middle cerebral, anterior cerebral, and the posterior communicating. Like I showed you before, the posterior communicating is like one beard. There's one on one side, and there's one on the other side. And this creates a circle. Very important. Here's the basilar coming up. Remember how I said the basilar turns into the posterior cerebral? Look, it does this. And now it's the posterior cerebral. These two branches, which aren't labeled, those are the superior cerebellars. In between there would be cranial nerve 3. Here's what's key about the circle Willis, why strokes are not the #1 killer. If I have a blood clot over here in the internal carotid, I could still get blood supply going this way and going around over here to go this. Does that make sense? I have a blood clot over here. Blood can still get the other way. The circle is vital. And you could have a blood clot there and not even know it. That's why you need to see the doctor quite often so they can check things for you, see if there's any clots going into your internal carotid, if there's some narrowing going on. They want to see this. This is what it looks like too. All right, there's your circle. There's your pontines, those branches that I didn't mention, but the pontines are coming off the basilar to give blood supply to the pons. So if you can identify these, there's the answers. All right, same way here. These are the answers. Should be able to do this. I also have this model here. Okay, so you can see it. Everything is on here. All the blood vessels. And you can see on the side here also. Internal carotid branches off into two things. One going outside the skull is the external carotid. One that goes inside the skull, and you can look in here. All right, we'll look on here. Or I took the liberty to take a picture of this, and that's where that is. So let me show you what's going on here. You see the circle, right? Okay. There's the circle. This is the end of the internal carotid. 3 branches. 1, 2, 3. Anterior cerebral, middle cerebral, posterior communicating. You got one on that side too. There's the anterior communicating. That's what makes the circle. Here's the vertebrals coming up. All right, there's the anterior spinal going down. The spider's peduncle, right? So there's the vertebrals going up. Goes into our basilar. You have little branches coming off the middle here. Those are your pontines. The vertebral arteries become the basilar, and then it becomes the posterior cerebral. The first branch coming off the basilar is the anterior inferior cerebellar. The last branch off the basilar is our superior cerebellum. So this is the posterior cerebellum, this is the posterior cerebral, and this is the superior cerebellum. See the little yellow thing coming out there? That's cranial nerve 3. Cranial nerve 3 is the hairy armpits. It's going to divide between the posterior cerebral and the superior cerebellar arteries. The only thing this is missing, for $3,000, that model, I would expect it to be perfect. The company says, well, do you expect it to be perfect? Yeah, for $3,000, I do expect it to be perfect. It's missing one artery. The posterior inferior cerebellar. And that should be coming off the back leg, off the vertebral. There should be one going this way and one going that way. So if I was going to ask you that, I would ask you on a picture, because we don't have a model that has that. Okay? So you understand what's missing over here. There should be a feeler coming off the back legs. And it's not there. Okay? Otherwise, this is a wonderful, wonderful model. Questions on that? You guys go into radiography, you better know the circle of Willis. You could see it, can't you? Right? He's there. This is what I'm just emphasizing. If there's a blood clot over here, blood supply can still get to the other side. That's the significance of the circle of Willis, a circle there. We have things called a Berry aneurysm. They can burst, all right? A Berry aneurysm, if this is a blood vessel over here, we could have an aneurysm that kind of looks like this. I kind of showed you the other day. Or we could have something that kind of looks like a berry. Either way, this is a very thin area and it can burst. A lot of people have, well, not a lot of people, but people who have berry aneurysms don't even know they have them. It's a congenital thing. And it could be right there. If that bursts, blood is just going to pour out of there. I don't care if there's two ways that blood can get to, it's still going to pour out of a hole. What it looks like is, and it leads to a stroke, which is a cerebral vascular accident, which is the number 5 killer in America. All right? And like I told you yesterday, you better know the 10 top killers in America, because these are the ones that are going to be on your board exams. They want to make sure that you know the things that are coming into the hospitals and doctors' offices. So they will have tons of questions about heart attacks and strokes and stuff. All right? Maybe not so much about, like I said, Down syndrome and autism and stuff. They'll have questions on it, not much that you're going to get into this. So what does the Berry aneurysm really look like? That. You can see how thin that is. That'll burst. This is what usually, someone young, like someone in their, 20s or 30s, they had an aneurysm and it blew and they died from it. Okay? It's usually a Berry aneurysm that caused it. Okay? And unfortunately, there is no signs that you would have this. And it's not cost effective to give everyone a CT scan of the head. Because it is still pretty rare and it's not cost effective to do that. Insurance companies would not do that. Okay? So some highlights about this. The common carotid, we break up into the internal carotid and external carotid. The internal carotid gives the blood supply to the brain with the help of the vertebral arteries. The external carotid gives blood supply to the face, with one exception, the superior thyroid artery. I won't ask you about that. I just don't want you to go into a future course and you say, well, Dr. Cabral says everything happens in the face from the external. No, there is one exception, all right? It's just to be complete on that. The superficial temporal artery is another one that you should know, and it's on that list. The superficial temporal artery is the last branch off the external carotid. And it's also a pulse-taking spot. If you take your finger and go in front of or anterior to that hard thing in your ear, that hard thing that's anterior to your ear hole is called a tragus. If you go anterior to that and a little bit superior, your finger kind of goes into a little crevice or a fossa. If you put your finger there and hold it there, you'll feel a pulse. That's the pulse of the superficial temporal artery, which you could actually see over here on this model. It goes all the way up here. That's the last branch of the external carotid. If I feel a pulse there, then I know the roadway up there is very clear. There's blood supply that is going through the external carotid. If I'm getting blood supply to the last branch, then I know that's good blood supply. And we could actually take a pulse there. For some reason, if you can't, you're a nurse in a hospital and you try to check the pulse over here and you're not feeling it and you're talking to the person, Lord help you, but if you can't feel it for some reason, I don't know, maybe there's a lot of, well, it could be that there's a lot of like a posy on there or something like that. You can't get that. But you could go here, you do the groin. You can go up to the ear and do that. Your head nurse will walk into the room like, what are you doing? Oh, this is something I learned from Dr. Gamarra. Oh, Dr. Gamarra, go ahead, just continue to do what you're doing. No. But you could take a pulse here. You could take a pulse at the top of your foot, behind your knee. I'm going to show you those places. These are all places you could actually take pulses, okay? So the blood supply to the brain is the internal carotid and the vertebral arteries. And keep in mind, the vertebral artery changes its name twice. It becomes the basilar artery at the level where the pons is, and then it's going to become the posterior cerebral when you get to the cerebrum. Okay? Sounds good? Now, I'm going to make this easy for you. The veins of the head, you don't have to worry about. All right? It's because we don't have good models of this. All right? So you don't have to worry about the veins and the sinuses of the head. Not going to ask you. Okay? However, there is 3 I want you to know that's going to dump into close to where the heart is. Those you need to know. All right? We basically have the external and internal jugular veins. All right? So they're over here. This is going to be the internal jugular that goes into what we call the brachiocephalic vein. We'll talk about that after the break. And we have the external jugular that gives blood or dumps blood into the subclavian vein. And I'll show you that in another picture. We also have the vertebral vein, which is going to ride alongside in opposite ways with the vertebral artery. So that too is going to go through the foramen of the cervical vertebrae. And that's going to dump into the, that picture's wrong. It dumps into the subclavian vein. That's wrong. But you'll see it on my pictures I'm going to draw. All right? That is wrong. Okay? It actually goes into the subclavian. Because where does the vertebral artery come from? The subclavian artery. So where would the vertebral vein go? To the subclavian vein. Does that make sense? All right? So be careful of all the pictures that you see out there. So I'm going to draw the picture. You'll see it afterwards. All right? I put this up here not to confuse you, but you don't have to worry about this. Once we get a model that has a good venous system in the brain, this is an excellent picture that you could learn from. So I'm leaving that up there for future references, but not for you. But if you're curious, it's up there. Okay? And just another picture showing those 3 veins in here, but I'll talk about that after